Welcome back to Arab Health Week 2021. I'm Dave Sharp, your host and moderator for today. We've still got plenty coming up, which we'll announce to you later. Remember, this is your event. Take part, you can chat, you can ask questions, and of course, you can connect with each other. A fantastic opportunity for you to build relationships and create a brilliant community for healthcare professionals. So if you want to continue the chat, of course, we are on social media today, Twitter, Instagram, Facebook, LinkedIn, using the hashtag Arab Health Week. That's all you need to know, and you can keep that conversation going. So up next is Dr. Farida Al-Hosani. Now, sadly, Dr. Farida couldn't be with us today, but she did put a presentation together for us. It's all about shaping the health sector in the United Arab Emirates. Dr. Farida Al-Hosani is from the Abu Dhabi Department of Health. She sent us this presentation. You can watch it on catch up later as well. Unfortunately, there won't be any questions for her, but it's a fascinating insight. Please welcome Dr. Farida.
Greetings. Good afternoon, everyone. This is Dr. Farida Al-Hosani from Abu Dhabi Center of Public Health. I'm really glad to be with you today to share and to shed the light about the future insights of healthcare sector in United Arab Emirates. I will focus within my domain of experience related to public health and the different experience dealing with COVID-19 pandemic in the last 2.5 years. So during this presentation, I will cover, I will talk about the patient care transformation and how we are foreseeing the future of the patient care transformation based on the changes that are evolving with time very rapidly in Abu Dhabi and in United Arab Emirates and globally as well. There has been a lot of trends that could give us some insights of what's going on within the patient care experience. In addition, I will talk about the reshaping of health research and what are the changes that are going on within the public health domain, and sharing some of the programs and experiences that we had in terms of the transformation of the public health programs within the Emirate of Abu Dhabi. And we will talk also about the evidence-based policy decision when it comes to how we are designing our different indicators to be able to monitor what is going on within the healthcare sector, but also within the population health in general, to have a better understanding of the needs of the community and how we can better serve our community and adapt to the changes that are going on. We will talk also about the utilization of big data and data integration, and what are the examples of health and non-health integration that can help the health sector to perform better in terms of understanding the patient's needs. And also, in addition to that, we will talk about the link between health and non-health information. COVID-19, since the beginning of the pandemic, it has really changed a lot in our lives and in the way we are working and dealing with others. And in the healthcare sector, it has a huge change in the way we are delivering the services and the way we are thinking about our patients' health and needs and care. So during the pandemic, our strategic main focus was to minimize the disease impact. When we talk about the disease impact, it means that we were working to ensure that the reduction of the mortality, to reduce the fatalities that are caused by the disease. In addition, during the pandemic, communication was a key issue. So during the pandemic, there has been a lot of focus on how to engage with our community and how to educate them about the public health measures and the interventions that they can take to protect their lives and protect the lives of others. In addition, we had to work in the capacity building because with the surge in the number of the cases that were rapid, very rapid in certain point of times, in certain geographical locations, the adaptation of the healthcare services was very hard. And this caused a disaster and crisis in certain countries because they could not cope with the requirements of the patients. In addition, the other dimension was the business continuity and how we could really continue to provide the essential services, including chronic health diseases, including vaccination, including emergency care for other patients who are coming for other reasons other than COVID. So how we could really work to ensure that we could deliver those services despite all the huge demands that were created because of the COVID-19 pandemic. One of the major important focus areas that we had is we were dealing with a new disease that we didn't know about before. So research and innovation was very crucial because we want to really expand in our services and we want to learn more about the disease to be able to fight it. So research was a critical part of our response. And for all of those areas, you could see that technology and AI played a major role on this. Being able to cope very rapidly with the patient's need, with the human resources demands, with the services that are required, we had to think differently. So this challenge that we faced brought us more closer to the future by quicker adaptation of technology and innovation to ensure that we are continuing to provide the care required for our patients and the care required for our community. So patient care transformation has different trends that are going across the world. One of the things that we even talked about before COVID-19 was the telemedicine. Although it has been moving, but it was slowly, the COVID-19 pandemic forced us to think differently and try to adapt technologies much quicker than we will do that. So this challenge created chances that we can really adapt to the changes that we need to ensure that we are talking to the patient. So the challenge we had during COVID-19 in terms of reaching patients, especially elderly patients who are difficult to move or they are high risk of getting the infection, we had to keep them in the home, but provide the care remotely using different means, whether it's a teleconference or a video conference with the doctor, in order to ensure there is a continuous follow-up. And although in the beginning doctors were resistant to those technologies, we could see that the adaptation was very fast. And I will share you some of the studies that has been done in UAE to assess the doctor's attitude regarding telemedicine and what are the opportunities that we have. In addition, the portable diagnosis and using mobile or other portable means for diagnosis of certain conditions have been really dramatically evolving with time, and we could see a lot of new diagnostics that came to the market that help the doctors to monitor the patient status or to diagnose the patient much quicker. One of them, for example, the example shown here is using mobiles to monitor ECG changes, electrogram, the electrodiagram that can give us indication about what's going on within the patient health without the need for the patient to be in the hospital or in the clinic to do the ECG. In addition, you could see also things that were invented recently that can help to monitor the patient progress regardless where he is, whether he is inside the country or outside the country. Example of that, the use of modern technologies using mobile applications to track patients with diabetes, with any other health conditions that we are caring about as well, especially the chronic conditions that require continuous monitoring and evaluation. Another trend that has also dramatically changed is going to change even more in the future is the use of home care services. We started a couple of years back with providing home care services for elderly population or people who have difficulty to be mobilized. But currently, home care services is a core service that is provided, whether it's for routine vaccination, for diagnosis, for follow-up of patients, for post-operative care. So it is a really wide variety of services that can be provided while the patient in his home. And this will minimize, it has a lot of benefits. One of it is to minimize the infection that might be acquired during the patient's stay in the hospital, and having a better convenience and improving the patient experience when he is getting the care needed while he is in his home with his family members. So those are 4 trends that are changing and evolving with time. But also it's important to monitor how effective we can use those and how they can enhance, whether it's the patient experience, patient management, and the patient outcome. So evaluation of those trends, continuous evaluation and continuous developments of those dimensions is very important, because it can help us to shape the future of how we can deliver the healthcare to our patients. Moving to next slide, this is a paper that was research that has been conducted in UAE, in Abu Dhabi specifically, talking about the experience of doctors on handling the telemedicine, whether it's video conference or teleconference, at different specialties. And we could see that it has been used for in different specialties, such internal medicine, family medicine, and some other specialties as well. The main results of this study indicate that video consultation should be adapted frequently in the new remote clinical consultations. You could see that the previous experience with telemedicine was associated with a twofold confidence in treating acute conditions and less than a half of the perceived risk of misdiagnosis. So the telemedicine is really improving, and the confidence of doctors on using the telemedicine in different specialties is increasing with time. And it increased the ability to provide the patient with health education and enhancing the physician-patient rapport. In addition, these results shows that the audio consultations are equivalent to video consultations in providing remote follow-up care to the patient with chronic conditions. These findings definitely are very important for the policymakers and for the program leads because it will have many benefits in different countries, especially countries with very high difficulty to provide clinics in remote areas, and also improving the patient access by reaching to their homes or through a mobile application or through mobile. Moving to public health, major areas of transformation are going on, and we could see that the delivery of different programs have been really dramatically transformed, and we are expecting the use of technology more and more in the future. For example, in communicable diseases, we shifted from the manual reporting to integrated dashboard that is linked with the patient electronic record. So in most of the previous cases, we had the physicians have to report filling a form. We shifted from that into electronic system that need to be filled again by the doctor, but eventually we are shifting to an integrated system that will not add any burden to the doctor. So once he entered that diagnosis in the system, automatically it can be reported. And again, there are many applications that has been added to the control programs. Example, we had the video follow-up, VOT, video observed treatment for TB. So we could follow the patients with TB and make sure that they are continuing their medications throughout the period of 6 months or 1 year, so we have a better control of tuberculosis disease. In chronic diseases, we also shifted from doing and conducting researches to understand the burden of different chronic diseases such as cancer, diabetes, or asthma, or many other conditions such as obesity, for example, in children. We used to conduct researches that would require 2 or 3 years efforts to understand what's going on. Now we have a better understanding of different population indicators, including continuous information about what is the burden of different chronic diseases in the community. And this could help us as public health practitioners to save time from collection of the data to move more into action-focused interventions. We could see also a major transformation in the awareness and the education of different public health programs. The use of social media to monitor population attitude, population's perceptions, and also the use of the social media platforms and the different technologies to educate and provide the information about how people empower people about how they can protect their health, how they can improve their health. So changing people's behavior, which is a continuous challenge for all public health leads across the world, is really changing as well. And we need to adapt to the new technologies in order to be able to drive a healthy behavior to our community. So we could see a lot of trends going on when it comes to the use of mobile applications or other means of technology that can help people to adopt a more healthy lifestyle. When it comes also to infectious diseases, one of the important things that is changing and evolving very quickly since 2020 is how we are using the big data to understand and predict more about what could happen in the outbreak. And I will talk in more details about our experience and global experience in using of different modeling, such as the use of modeling to understand what's the expected numbers of beds required for patients in the upcoming period. And this is basically using different information that we have about the disease. For example, what is the length of the what is the transmission speed of the infection, who are the close contacts, and what is the rate of the transmission for every individual. Different informations related to the behavior of people, such as if there is a lockdown, the mobility of the people, which is again some of the informations that are available publicly, but also other behaviors like, for example, the opening of borders, especially the airlines, and how could this impact any disease condition, especially the infectious diseases that can be transmitted from one country to another. So we could see that many models have been used and adapted by different countries to have a better understanding of their disease epidemiology at this stage, but also using the epidemiological and clinical information that are available in order to try to help the future planning when it comes to the beds capacity or the policy decisions to be taken during any outbreak. So this is a live example of how each country used the modeling, and those are some of the publications that are available on how they use the modeling to predict and to have a better understanding of the disease of COVID-19. But this is also a trend that we will see in the future, that we will have to develop and learn and adapt to those changes and ensure that we are trying those methodologies and knowing their pros and cons to be able to use it in any future pandemic. Sharing a local example, we worked with UAE University to develop our own model using age-structured modeling of COVID-19. And this was last year in March and April 2020, when we worked closely with a group of researchers from UAE University to try to understand what's going on within COVID and what is the increase expected in the upcoming period. Our experience in this is we had to develop our own model because the epidemiology of the disease is different from one country to another. There are many determinants that are changing and evolving with time. At that time, our important difference from any other countries is we had a large number of labor workers that need to be considered in the model. So we had to split the model into two groups. We had to split the population into two groups. The workers, labor workers, and others from the residents and nationals. And the big differences between those two groups is labor workers had to live in a more condensed population. So taking in consideration that one case could affect many others in the same living area or the work area where there is a lot of condensity compared to UAE nationals or residents who live in their homes with a less exposure when it comes to numbers. So predicting this difference is very important and help us to have a better understanding of what could happen, what is the worst case scenario, and what is the best case scenario that could happen in the prediction for the next period. Where are we now from the modeling? I think this was a very rich experience on how we could use technology and use the data. At a certain point of time, we had to add additional publicly available information, such as, for example, Google mobility data, to see how did the, for example, lockdown affected our country or any other countries when it comes to the disease prediction. We are currently working to develop further this model to include new determinants that came in 2021, such as the vaccination and how this could affect the disease prevalence, what is the possibility of the reinfection, what is the expected severity, because the severity of the disease even changed from last year. If we compare the wave that we had last year in March, April, it's very, very different from what we could see in March, April this year. So counting for those differences is very important to ensure that our model is accurate. So we are currently working to really update the model and also include the changes that are happening within the spread of the infection and its changes related to the variants, different variants that are reported from across the world. So this has been very useful experience. However, we foresee that the dependence on the predictioning in the future and the use of the big data, whether it's really, for this example, we used health-related data such as disease prevalence and risk factors related to the patients. And we used also non-health data related to the people's behavior, such as movement, going to work, going to school, going for shopping, for example, and how could those behaviors change how the disease is evident in the community. The other area that is really evolving is research and the way we are conducting research. Coming from academic background and continuing to participate actively in the research for communicable diseases in UAE, I believe that there has been dramatic changes to the way we conduct research here in UAE and across the world. We used to have a slower rhythm of collection of data and analysis, but the pandemic and the challenges that we faced required a different way of work, especially when it comes to research, how we could expedite research very quickly to ensure that we are really getting enough evidence that can help us to shape and change the policies and adapt with the pandemic. So currently there is a registry that you can see and to identify all the different researches that are currently going on in United Arab Emirates. The DOH, Department of Health, registry that has capture of most of the studies going on in UAE. In addition, we had to develop our own data collection methods to understand what are the trends, what are the research trends going across the world, what are the areas of focus across the world when it comes to research. So being able to understand the global trends of research, but also participating in the research, trying to close some of the knowledge gaps that are available and support the international community through different researches that are conducted in United Arab Emirates. And fortunately, we have lots of researchers that came from UAE, and we could see also many clinical trials that have been started. So this is a new era of research that we will have to be different from what we used to be. For UAE, it was totally different, a new era, because we never started the clinical trials. But now we are really very actively participating in different clinical trials. There are at least 4 clinical trials that are currently going on to learn more about vaccines or different medications that are used for COVID-19. With this, I will end with the last slide, which is talking about the future directions. I think the area of the infectious diseases and the emerging infections is a huge area of development and focus in the upcoming period. So the current challenges that we are facing today are great opportunities to prepare us for the future. So we need to think beyond the disease and beyond the pandemic, how we could be more prepared for the future. So just to summarize, I think we will have to focus more on identifying gap in information and knowledge and trying to participate actively in the research going on, whether it's related to COVID-19 pandemic or any future emerging infection. Also, the way we are conducting researches, epidemiological researches, we need to have innovative ways of conducting contact tracing, for example, using a merger between the traditional methods that we are using and also new technologies that can help us to be more efficient, quicker, and get better results. So the use of technology and AI in health is not an option. It's currently a must. So we should really continue to explore what are the potentials of the different programs that we have, how can we develop, how we can evaluate the new methodologies and validate them to ensure that we are adapting the best of care services in United Arab Emirates. And the last thing is really we need to be more prepared for the future pandemic. healthcare readiness and infrastructure. There has been many lessons learned from COVID pandemic that we should not miss and we should use to be more prepared for the future. With that, I end my presentation. Thank you.
Thank you to Dr. Farida Al-Hosani for a valuable and helpful and fascinating insights there. What a lovely line that is. Current challenges prepare us for the opportunities ahead. We've got to be prepared. Nice little line to finish on. Remember, you can watch that presentation again on the Future Health YouTube channel, and you can stay in touch with us via the hashtag on social media, which is Arab Health Week.